presentation, equally exciting to me, is from our good friend and his colleagues, Chris Rosell. And Chris, what I'm going to do is, it's fortuitously you're right here. Of course, you're working with your colleagues, people to people, and the Yumbe Rotary Club group based in Chris's and his colleagues work in Uganda. I'd really like Chris to introduce himself and his colleagues and then get our presentation going. Please, Chris. By the way, as Chris is walking forward, check out the November issue of Rotary magazine. The Yumbe group is going to be featured. That's exciting, Chris.
It is. Good morning, fellow Rotarians and others. For the last few years, we've had the pleasure of forming partnerships in Uganda. And now our Lena is from South Sudan. And in Uganda, we're working with partners. This is South Sudan here, just across the border in Yumbe with the Rotary Club. And I'm going to introduce our partners in that enterprise, which are the Rotary Club and the president of the Rotary Club, Rukia Drisiru, who is a businesswoman, and Lenny Christie, who has a public health degree, master's in public health, lives up in this rural area, is going to present. And the other person who's going to present is Ajaga Innocent, who is the director of an indigenous NGO nonprofit and also a Rotary Community Corps volunteer. And they're going to present what they're doing in partnerships to eliminate diarrhea in a sustainable manner through WASH projects. And they've also added on eliminating malaria, which is a water-related disease. So some of the communities we work in have incidence rates of 92% of everyone has malaria at any point in time. The community spend 30 to 50% of all their household income treating diseases no one should have. So with that, I'm going to turn it over to our friends from Yumbe, and I hope that they are online to do the presentation. They're in the general breakout session, but I'm not sure if they've gotten to this specific one. So, Rukia, are you online? So they have not been introduced into the breakout session.
Brett, can you make that connection for us?
So the person is named Rukia, and they've got all three of them ready to come on.
And they were in the session downstairs.
They were in they're online. They just haven't been admitted to this room. Rukia, yes. Great. And they're all there, right? Great. Well, they're all three there.
One station.
On one. I know how to do this when I'm running the Zoom session. I've never figured out when we go into multiple layers.
Trying to get the heat up. She's grayed out.
So the RQKIA,
Don't know what you could call
RQKIA.
Okay, can you text her? Or chat with her?
Let's see. Now that I'm in the room, I gotta go to, I can't use the P50. So I will go to. So what do I tell?
She hasn't joined the breakout room.
Join the partnership breakout.
Yes.
Oh, that's in the background. That's part of it.
Like that. Like,
Yes.
well, let's go back to the presentation and I will unfortunately give it rather than them giving it. So rather than wasting your time, so what we are focusing, well, we've got partnerships for doing the work with this Rotary Club. The partnerships are the Rotary Club, the Indigenous NGO, the District Health Officer office, the area officer, water officer in Yumbe District. We've got the Rotary Club of Odua, which mentored this new Rotary Club. It wasn't admitted as a Rotary Club until April of this year. And since that, they completed the work with a community and finished it with another community. And these communities are basically 600 to 1,000 people each. And the work they do, the other partners, I should say, are international NGOs, microloan organization, which you all understand how microloans work. They have money, they lend out the money to individual entrepreneurs to return it with interest after they've made money, and typically they double their money. So that organization is a Rotary organization known as TCP Global. And then another one called Good Foundation International. And Good Foundation International specializes in making hot filters that remove 99.9% of bacteria from water. They're silver integrated hot filters. But they also teach the local women how to make reusable sanitary pads, how to make reusable diapers, which are major expenses and major losses of attendance at school. The main reason that young girls drop out of school is to carry water for the family or to herd animals to and from. The major reason girls drop out of high school is they start menstruating and they don't have protection. So this is a new club. The district has 580,000 people in it. And additionally, they have a refugee camp. And the refugee camp is South Sudan, just across the border, 230,000. So this 500,000 has invited in another 230,000. And we're working with, and this Rotary Club is working with small. So major things we work on are wash and elimination of malaria. Why do we work on them? When we've interviewed communities and asked them if we could do anything in the world, what would they have us do? The number one choice is water. And the number two choice is water. One is drinking water. One is irrigation or manufacturing production. Those without water. So we work on those three things. We go to the next one. The process is aimed the 3 villages so far. We just signed an agreement, a partnership agreement between our multiple agencies with the 4th community. We prefer to do more, but we don't have enough money to do more. So we do these services, water, sanitation, hygiene to eliminate malaria and soap making. Because if they don't have soap and we're still contaminated. And malaria elimination. And part of the reason is in Uganda, the number 2 cause of infant and child death is diarrhea. The number 3 cause of infant and child death is malaria. And to stop them and this suffering and misery in the families goes away. So these are some of the impacts we measure. We have a survey that is on in water, a community survey that we conduct at the start of our work and the finish of our work. And we do all of these things. We use, and I have questions about using the Sawyer 0.1 bucket filter that is 99.9997% effective in removing bacteria. And my reluctance is I've got to implement. Next slide. So these are the club's goals. They want all of the communities in UMA. There are only 800 communities. They want all of the communities in UMA to have access to malaria prevention. for obvious reasons. Communities, besides having 90% suffering malaria, they spend 20% to almost 50% of their household income, paying $1 a day per person. And you're thinking too much. They spend up to, my latest survey is 49%. They spend there at the house. Increase clean water, safe water, improve sanitation and hygiene. Thanks. Our methodology is first we select areas, but then we advertise by radio in the area that there's this opportunity. But for the community to get this opportunity, they've got to collect community data, they've got to collect signatures of all heads of household that they want this and that they're going to work with it. And they've got to write us a brief letter saying, please come help us. Why did we do it then? If we select the community, then it's hard for the project to be there. It's going to be our project. We let them self-select. The other thing is if they self-select, our work is cut way, way, way down because these are the early innovators, the self-initiators, the ones who want to get it done. We put some requirements up there to get in, and they've had to jump the hurdles to get in. So we start off with the radio advertisements. They come to us, then we go to them, check them out to make sure that the conditions they are reporting on our requirements are that they lack safe water, that they lack, that they have a major problem with malaria, and that they want to improve their conditions. Once the Rotary Club has selected them as, yes, they do actually meet our criteria, we sign a partnership agreement with all partners, the village, the Rotary Club, the NGOs, with them, saying who's going to do what, by when, where, how, and you get.
Excuse me, I hate to interrupt, but Rukia is in the room. Is there some way we could put her in?
So let's turn it over to Lenny Christine to finish this presentation.
And Tim, how much time do we have left in our session?
We're going to go until 10:50, so 15 minutes.
We have about 10 or 12 minutes left.
Well, yeah, we're going to have some Q&A.
We have to have Q&A too. Thank you, Chris.
So Lenny Christine, I've led you up to this slide. Start with this one with the activity and impact. Everything else has been covered because I couldn't get connected with it. Unmute your microphone and speak, please.
Thank you, Chris, for jumping in so nicely.
Your microphone's muted. All right.
Thank you so much, fellow Rotarians from USA and East Africa. I'm Lenny Christine, a Rotarian from Yumbe Rotary Club. As the first presenter had helped us as we had problems to enter in, I'm going to continue from activity. The Rotary Club Yumbe has improved the hygiene and the sanitation of 3 villages in Yumbe district, that is Idula, Odropi, and Achiba. You can see the second row is where the Rotarians are doing hygiene together with the community members in the community. And the next picture, the second row, is how we train the community on how to make the cover plates for the latrines to keep the latrine very clean. The impact, you can see our impact is that latrine coverage improved from 34% to 99%, The area has reduced from 98% to 28%. Hand washing facility increased from 10% to 99%, and clean source of water improved from 35% to 95%. As you can see it from the third row, the first and the second picture showing the impact, complete latrine being built with the touchless tip tap installed, community members already using it for hand washing. Next slide. Next slide will be presented by Rukia, the president. Thank you. Hello all Rotarians. I am Rukia, the president of Rotary Club Yumbe, taking you on the next slide. Provision of clean water. We use methodology. The methodology we use is through radio adverts to select the best village. As you can see, the picture number 1, the Rotarians are signing agreement with the community members. Then picture number 2 shows the community contribution towards the project we are implementing. You can see the bricks contributed by the community and also the labor, the sand, and the stones. We go to activities. Yumbe Rotary Club provided 1 deep borehole and 28 bucket filters. As you can see, picture number 1 shows a heavy machine drilling a deep borehole. Then picture number 2 shows a soil well done by the hand with the community, contributed by the community. And also picture number 2 shows the distribution of bucket filters to the community members. As you can see in the 3 villages, that is Odropi, Dula, and Achiba. We have the impact. 93% of unsafe water source reduced to 32%, 78% of waterborne diseases reduced to 35%, 4 hours spent fetching water is reduced to 1 hour. As you can see, the community members jubilating how to pump a new borehole. Picture number 2 shows how happy the woman is when pumping the water. Picture number 3 shows how the community members can take water from the soil filters. It's 99.99% pure. Next. Challenges. Malaria elimination, the methodology we used, as you can see, we have home visits, the Rotarians sensitizing the community members on how to prevent malaria. Picture number 2 shows community dialogue. The Rotarians having community dialogue with the community members. The activity, malaria elimination activity is done by the Rotarians of Yumbe in 3 villages. That is Odropi, Dula, Achiba, with the help of village health team and the district health office focal person. As you can see, the district focal person is training the Rotarians with the village health team. Picture number 2 shows home-to-home test and treat. We treat the youth, the young, and the adults. Impact. We realized that 612 tested, of which 356 tested positive in Achiba, and 1,246 tested, 784 tested positive and treated in Dula, and 2,560 tested, 1013 tested positive and tested in Odropi. In total, we have 568 households reached in 3 villages. As you can see, we have massive tests
As you can see in the pictures, number 1 and 2, how the community members signed up for the test and treat program. Next. We have challenges encountered. Transport for field visit is limited. Resources for the programs are not enough for expansion. Many villages are seeking for support to implement the program in their areas. Mosquito nets are torn and lacking in many households. Next. Lessons learned. Increased rate of planting mosquito repellent plants around households in the beneficiary villages can reduce the spread of malaria. Establish approach to listen to audio messages on malaria prevention through motorcycle talk by the community members. The growing appreciation and focus by the communities on sanitation, hygiene, and safe water use. Community-led projects and involvement of international volunteers, district local government, and local actors in project implementation have greater impacts. Thank you so much. I hand you to the next presenter, that is Innocent Jaga.
Yeah, thank you so much. Thank you, moderator, ladies and gentlemen. My name is Innocent Ajaga, Executive Director, SEDOC Child Development. It's a local indigenous NGO that partners together with YumbeRotaryClub Club to implement the projects in rural hard areas in northern Uganda. And I'm also a team leader of YumbeRotary Community Corps. So I'm going to take you through achievements in our activities. As you have seen on the bar graph, it shows our achievements. Water source, Odropi village increased from 35% to 95%. Dula village increased from 28% to 97%. Achieva village increased from 40% to 99%. Decrease in malaria. Odropi village decreased from 75% to 25%. Dula decreased from 74% to 34%. Achieva village decreased from 68% to 20%. Safe sanitation and hygiene. Odropi village increased from 49% to 98%. Dula village increased from 28% to 48%. Indeed, why Dula community has a low sanitation and hygiene? We learned a lesson from it. First, when we looked at the situation of Dula village, we realized that water was a very big challenge. So when we provided water to the communities of Dula, and then reaching to the second activity, that is latrine construction, we realized there was a relax from the community to support the project. So that gave us a lesson learned. So by the time when we started with the Odropi and Achieva village, we started with the sanitation and hygiene, and the water followed later. And it had helped us to achieve a great impact in those two villages. Next slide. Recommendations for performance improvement. Yeah. Next slide. Recommendations for performance improvement. New mosquito nets need to be given out to the households. We realize that many households do not have mosquitoes. Other households have mosquitoes, but they are torn. So there is need to have more mosquito nets to help the rural communities of Yumbe district. Resource mobilization need to be in place to expand our programs because we have so many villages who are yearning our support. So we recommend that if we mobilize the resources in a way that we can expand our programs to cover other villages in rural areas of northern Uganda by the Rotarians of Yumbe. VHTs, that's village health teams, need to be facilitated to implement the activities. Since they are the foundation, they have been recruited in the villages, they are the one looking for the communities, supporting them, helping them, treat them and test them. So there is need to facilitate them to implement the activities. And transport facilitation need to be fixed for the program volunteers, since we have a very big coverage in northern Uganda, particularly in Yumbe district. So there is need to facilitate the volunteers with the transport. Next slide.
Very slow.
Strategies for the next activities. Strategies for the next activities: evaluation, research and surveillance, capacity building, resource mobilization, sustainability. Next slide. Appeal. Rotary Club Yumbe hereby appeal to other clubs, philanthropic individuals, charity foundations, Rotarian volunteers to enhance and expand the activity impact undertaken by Rotarians of Yumbe in the communities. Through any kind of support can reach us on email, yumberotary@gmail.com, or Yumbe Rotary President at email, dishirurukia40@gmail.com, or to Yumbe RCC team leader at email innocent074@gmail.com. That marks the end of our presentation. So I welcome all the Rotarians and NGO representatives, well-wishers, for any suggestion and questions. Thank you so much.
2 minutes.
No, you have 0.
Well, technically.